Good afternoon, everyone. Welcome back. Thanks for joining us. We're glad that you're here. I'm Steve,
And I'm Scott.
and together we're Backyard Musings, the Science and Technology channel.
Yeah, we're talking about a pretty easy procedure that they're looking at to hopefully alleviate some pain with people that are suffering from osteoarthritis. Particularly in this particular study, it's in the knees, but um, we've talked about osteoarthritis and the pain that it gives in the last month or so, and actually longer than that. But yeah, let's talk about this one.
Yeah, so I've got a VA appointment with my doctor, primary care, on July 10th. I'm going to print out this article and I'm going to give it to him and say, hey, I want to try this, and hopefully this can happen. A minimally invasive procedure that blocks abnormal blood vessels around the knee may offer lasting relief for people with osteoarthritis who have exhausted standard treatments. For millions of people with knee osteoarthritis, treatment options often fall into an uncomfortable middle ground. Medications and injections may no longer provide enough relief, while joint replacement surgery can be too risky, undesirable, or premature. New research suggests a minimally invasive procedure that targets abnormal blood vessels around the knee could help bridge that gap, providing significant and lasting reductions in pain while improving mobility and quality of life. Would you like to know more?
The findings published in Radiology on June 16th of this year show that immobilization using rapidly resorbable gelatin-based microspheres was safe and effective in patients with osteoarthritis-related knee pain. Knee osteoarthritis affects more than 365 million adults worldwide. That is astounding, and is among the leading causes of disability, often causing chronic inflammation, stiffness, and progressive loss of function.
That's true.
That's probably your most used joint in the body, I would think, right?
Yeah.
Yeah.
A lifetime of being in the Army just wears and tears on those knees. And so I've mentioned before, Scott, we had that story about inulin, and I take inulin, and that has helped tremendously with the pain. And I also have these electrode things that are on a Velcro knee wrap that send electrical pulses to the muscles around the knee that makes them fatigued, which also eliminates the pain. And it's momentary. It's pain management is what it is.
Okay, and your inulin, that is available across the counter, right?
Over the counter. It's a supplement. Yep. Yeah, we have that story. If you want to go back, folks, it's probably 2, maybe 3 weeks ago. We had this story about the inulin.
Right.
Okay, quote, for many patients with knee osteoarthritis, there is a real treatment gap today, said Florian Nima Fleckenstein, medical doctor, deputy head of interventional radiology campus Mitte Charité, Universität Medizin Berlin. So it's a German person. Continuing her quote, conservative measures such as intra-articular injections no longer provide sufficient relief, but joint replacement is not an option for medical or personal reasons.
Genicular artery immobilization, or GAE, is a minimally invasive procedure that targets abnormal blood vessels surrounding the knee joint. In osteoarthritis, these vessels can accumulate around the joint and contribute to ongoing inflammation and pain. During the procedure, an interventional radiologist uses a thin catheter to reach the affected vessels and injects tiny particles that block blood flow, helping reduce inflammation and relieve pain without surgery.
Sounds awesome.
Yeah.
The researchers proposed that genicular artery embolization performed with rapidly resorbable gelatin-based microspheres could combine the advantages of both temporary embolic materials and permanent microspheres while avoiding some of their drawbacks. These specially designed spherical particles are calibrated by size and dissolve within hours.
Okay, quote here. GAE is a whole new treatment regimen that targets abnormal hypervascularity around the joint and, in turn, modulates the pathological neurovascular environment. And that's according to Dr. Fleckenstein. Going on with the quote, by reducing both inflammation and pain, GAE with resorbable microspheres may be the first procedure that alters the course of the disease, slowing its progression, unquote.
Awesome. Oh my
Yeah.
gosh. The potential relief here is just awesome. This prospective single center study enrolled 194 patients with osteoarthritis related knee pain, including 114 women and 80 men. All participants had failed to improve after at least 3 months of conservative treatment, including physical therapy, anti-inflammatory medications, and intra-articular injections. The median age was 69, and the median body mass index was 28.4.
Another quote, we believe these results carry real weight because they come from the real world data, according to Dr. Fleckenstein. Going on with a quote, with this broad, inclusive study design, our participants are exactly the patients that physicians encounter every day in their practices, unquote.
All participants underwent GAE using the resorbable microspheres between July and November 2024. Among them, 45 patients, or 23%, received 2 procedures to treat osteoarthritis in both knees, with the second treatment performed within 4 weeks of the first.
A total of 239 GAE procedures were completed under fluoroscopic imaging guidance. Every procedure was technically successful. No moderate or severe adverse events occurred, and only 6.7% of the participants experienced mild self-limiting reactions. That's pretty good.
Awesome.
Yeah.
Researchers evaluated outcomes at baseline and again at 6 weeks, 3 months, 6 months, and 12 months after treatment. The 6-month examination was conducted in person by an orthopedic surgeon. Follow-up rates remained high throughout the study, reaching 94% at 6 weeks, 89% at 3 months, 89% at 6 months, and 79% at 12 months. That 79% is 154 out of 194 patients.
Those are all really good numbers, right?
Yes.
Okay. Another quote. In our cohort, we saw a significant drop in pain and a significant increase in function, including sports and recreation and daily activity. What else do you got? That's according to Dr. Fleckenstein. Going on with a quote. More importantly, their quality of life significantly increased. That's an A.
That's awesome.
Yeah.
Pain levels improve rapidly and continue to improve over time. On the numeric rating scale, 0 to 10 measure of pain intensity, the median score decreased from 7 before treatment to 4 after 6 weeks, and then to 3 at both the 6-month and 12-month follow-ups, showing sustained improvement throughout the year.
Knee injury and osteoarthritis outcome score results also improved across every measured category over the 12-month period. Median daily activity scores rose from 53 to 71.5, while sports and recreation scores increased from 15 to 36. Wow. Symptom scores improved from 51 to 68. Pain scores increased from 44 to 65, where 0 indicates extreme knee pain and 100 indicates no pain at all, and quality of life scores increased from 19 to 40.
Wow.
Big numbers.
Big numbers. Previous research has established that a reduction of at least 2 points in the numeric rating scale and improvement of at least 10 points in the knee injury and osteoarthritis outcome score subscores represent a minimum clinically important difference.
By the 12-month follow-up, 80% of participants had achieved improvements that exceeded the minimum clinically important difference according to their numeric rating scale pain scores. Okay.
Quote, our study demonstrates that GAE using rapidly resorbable gelatin-based microspheres is a safe, minimally invasive therapy that provides meaningful pain relief and functional improvement in participants with osteoarthritis-related knee symptoms for at least 12 months. Dr. Fleckenstein said, continuing the quote, by embolizing the pathological vessels, we're able to normalize the vessel structure and in turn the neuronal structure of the knee.
Dr. Fleckenstein noted that this study involving nearly 200 patients represents the largest evidence base to date for GAE using rapidly resorbable microspheres. Quote, this lets us speak about safety and efficacy with real confidence, he said. Going on with the quote, for the right patient, it can mean lasting relief from a single, minimally invasive procedure, a meaningful new option between injections and joint replacement.
Yeah, so when I see my doctor on the 10th, I'm going to take this article and I'm going to say, I want to try this. Let's make it happen. Whatever I have to, if I have to travel to wherever, I'll do it.
This could be a first.
Yeah.
Backyard Musings clinical trial. All right. We like it.
Stay tuned.
Yeah.
It's probably going to be an uphill battle with the VA. They're probably going to give me the stiff arm, and then I'll have to go to the medical director and say, why can this not happen? It's possible. Let's make it happen.
Call Donald Trump. He'll hook you up.
I'll write Donald Trump.
Yep.
All right, folks. Thanks for joining us. We'll catch you in the morning.
Take care, everyone. Thanks.